Greetings. My name is Dr. William Hersh, and I'm going to speak to you today about the informatics workforce and its certification in the United States. I'm professor and chair of the Department of Medical Informatics and Clinical Epidemiology in the School of Medicine at Oregon Health and Science University. This slide lists an outline of my talk. I'm going to begin by describing some recent work done by the American Medical Informatics Association in its workforce analyses. In particular, I will look at the two analyses done on the clinical informatics subspecialty and the health informatics workforces. I'll then talk about certification in informatics in the United States, talking about the clinical informatics physician subspecialty and the advanced health informatics certification. Before I start the content of my talk, let me remind you all that I miss you all. I miss everyone at Hospital Italiano and all over Buenos Aires and Argentina and South America. Obviously, we can't be together at this time due to the COVID-19 pandemic. But I thought I'd bring up a few pictures, starting from the left. The picture from the IMIA Latin American Conference in 2008 that was held in part at Hospital Italiano. You can see in the front row myself and Dr. Paulo Otero and others from the hospital who are at this conference. In the middle is a picture of myself during that same trip, wearing a t-shirt because that was about a month before a presidential election, just like there's one about to take place in the United States. You can see I'm wearing a sign of one of my favorite US presidents of all time, Barack Obama, who did great things in many areas, including health information technology. Finally, I was back in 2011 visiting when my daughter was coming to study in Rosario, and we came by Hospital Italiano and I gave a talk. My daughter is now a physician. She recently graduated medical school and is in her first year of residency in obstetrics and gynecology at OHSU Hospital. But let me move on to the topics of today's talk. Again, starting with competencies. What are the competencies of informatics professionals? What do we need to know? There has been over a decade of work on this topic. The decade of work was presaged by an article, a viewpoint that I wrote in JAMIA in 2006, asking who are the informaticians, who are the professionals and researchers and academics who work in the field of informatics and provide its leadership. At that time, there was not much known, but there was additional work that followed that helped to define our field, and I will in particular talk about the recent workforce analyses. One area of work was the development of the core content of the clinical informatics subspecialty for physicians. Work was done in the middle part of the 2000s decade and resulted in a proposal to establish clinical informatics as a subspecialty for physicians, recognizing, of course, that clinical informatics is not all about physicians. There are many other professionals who work in informatics, but the core content laid out what it was believed that physicians needed to know and where they needed knowledge and skills. The analysis led by Reed Gardner and others came up with 4 broad domains of core content, one being the fundamentals of the field, the second being clinical decision-making and care process improvement, the third focusing on health information systems, and finally the fourth acknowledging the importance of leadership and managing change. Another area of work came from the biomedical informatics field more broadly, led by Kaz Kulikowski, the development of core competencies for graduate education. A more narrow focus was on applied health informatics, led by Anna Valenta, And this analysis defined 12 foundational domains of informatics, basically being the concentric circles of health, information science and technology, and social and behavioral science, and then all the overlaps of those, and then surrounded by the areas of interprofessional collaborative practice, leadership, and professionalism. But the main analyses to understand the field come from the workforce analyses carried out starting around 2017 by AMIA, looking at the domains, tasks, and knowledge for first the clinical informatics subspecialty practice led by Howard Silverman and colleagues, and then the domains, tasks, and knowledge for health informatics practice led by Cynthia Gadd and others. Although these two workforce analyses were done independently, they came up with very overlapping tasks, knowledge, and skills for those in the informatics workforce. The upper table represents the 5 domains of practice for health informatics and also lists the number of tasks defined and knowledge and skills statements that would be required by professionals in the field. The lower table showing the domains for the clinical informatics subspecialty, and we'll review these and their overlap and other interesting aspects of them in the coming slides. So as I mentioned, there were 5 domains in each of the analyses, and at the top level the analyses were very similar to each other. In the next couple slides, I will integrate these analyses because of their similarities. So there were 4 domains, and these roughly correspond to the core content of Gardner and colleagues. The first domain being foundational knowledge and skills, so understanding informatics, health, healthcare, and other foundational aspects of the field. Second, health decision-making and improving care, perhaps a little bit more on the consumer and patient side for health informatics and the clinical side for clinical informatics. The third domain, health and enterprise information systems, obviously the information systems containing data and information that informatics professionals use, manage, evaluate, and so forth are key. And then for all informatics practice, the importance of the socio-technical issues, areas like leadership, professionalism, and transformation of individuals and organizations. But the key difference between the original Gardner core content and the new workforce analyses is in this designation of a 5th domain. The original Gardner 4 domains correspond roughly to the 4 domains listed in the previous slide. But this 5th domain recognizes the importance of data. Much more so than 10 years ago, data is central to what we do with informatics applications. So to pull out a few statements that describe this domain, which is numbered number 4 in the tables in the Silverman and Gadd papers. In this domain, it's critical to establish and maintain data governance structures, policies, and processes. It's critical to acquire and manage health-related data to ensure their quality and their meaning across different settings, and to be able to use that data to support individual and population health, and also drive innovation around health and healthcare. We need to incorporate information from emerging data sources, wearables, mobile devices, social media, all the other new data sources and ones that we can't even imagine at this point in time. But once we have the data, we need to derive insights to optimize clinical and business decision making. Further down in the knowledge and skills and the tasks are some specific points I think are worthy of mentioning at a high level when we're working with data. It's critical that we identify and minimize biases in the data and mitigate their impact on algorithms and other ways that the data are used. And of course, we need to implement and evaluate machine learning and artificial intelligence applications, which are making tremendous progress, but still have yet to find their place in the routine delivery of healthcare. That describes the competencies of informatics. Let's switch gears to certification. Of course, certification is all about certifying that an individual has the competency to be an informatics professional. Since certification started with the physician clinical informatics subspecialty, let's start there. In 2009, AMIA developed and published plans for the curriculum, the core content from Gardner, and the training requirements. And this is typically done in the United States with the establishment of a new specialty or subspecialty to define what knowledge is required and what training is necessary. In 2011, the American Board of Medical Specialties approved the new subspecialty of all specialties, and the American Board of Preventive Medicine became the administrative home with additional involvement by the American Board of Pathology. So clinical informatics became a subspecialty of all primary specialties, be that internal medicine, pediatrics, family medicine, surgery, radiology, etc. In 2013 was the first certification exam offered by both ABPM and ABP via the so-called grandfathering pathway, that is, physicians who had either enough training or enough practice to become board eligible to be able to sit for the board exam were able to take it. That year, AMIA launched its Clinical Informatics Board Review course, and 456 physicians passed the exam, which had a 92% pass rate, probably reflecting that many experienced informaticians were taking the exam, including from my institution of OHSU, 7 people, including myself, and I managed to pass the exam myself. In 2014, the Accreditation Council for Graduate Medical Education, or ACGME, which accredits residencies and fellowship, released its accreditation rules for clinical informatics fellowships. 4 programs were accredited that first year, including ours at OHSU, and 1 program from Stanford was launched. Another 329 individuals passed the certification exam with a 90% pass rate, bringing the numbers to 785 total. In 2015, more fellowship programs were accredited, a total of 15, and more were launched, a total of 4, including ours at OHSU. In 2016, the grandfathering period was extended for 5 years from 2017 to 2022, meaning that individuals, again, with a certain amount of practice or training could be board eligible and sit for the exam without doing an ACGME fellowship. By 2019, over 2,000 physicians in the United States were board certified in clinical informatics. The map on the right shows the rate of certified clinical informatics subspecialists per 1,000 physicians in the United States, and you see that different states have different rates of board certification. Looking ahead to the future of the clinical informatics subspecialty, as already mentioned, 2022 will be the last year of the grandfathering pathway, and starting in 2023, to become board certified, physicians will need to complete an ACGME accredited fellowship. But what about former types of training in informatics, such as graduate education and its delivery by remote learning, which, as many of you know, we do a lot of at OHSU? Certainly the coursework and knowledge and skills learning of informatics will be important, but of course that needs to be balanced with the context of hands-on experience in actual clinical settings. I note that about 5 to 6 accredited fellowships actually use our online courses at OHSU because they do not have the resources to develop their own didactic experiences. Again, informatics is not only about physicians. There are many other professionals, some from varying healthcare backgrounds, others from non-clinical backgrounds, who do important work professionally in informatics. To this end, AMIA has been working to establish the Advanced Health Informatics Certification, or AHIC. And this is an emerging plan that was introduced in 2016 to certify the rest of the informatics workforce. It will likely include all who have trained at the master's degree level, whether or not they have a health professions degree, and one can keep abreast of the current status of AHIC at the AMIA website. And the most recent action has been to appoint the Health Informatics Certification Commission, which will oversee the core competencies, the required curriculum and training, the certification exam, and so forth. What about the future of competencies and certification in informatics? Well, like many other areas of healthcare and life, COVID-19 has slowed things down. In particular, it has slowed the various routine developments. Yet, on the other hand, COVID-19 also demonstrates more than ever a critical need for informatics competency and the ability to manage healthcare systems, to manage their data, to use it to better understand the virus and how we treat it and prevent its spread most effectively. In the US, we'll see physician certification continue and transition to that fellowship model, and AHIC will develop. Thank you for listening today, and if you wish to follow up with me, you can reach me by email, visit my website or blog, or follow me on Twitter. I'll be happy to answer any questions at this point.
Bueno, ahora le agradeceremos en inglés al Dr. Hersh. Recuerden, no sé si alguien quiere hacer alguna pregunta, puede hacerla aquí en el chat y se la haremos al doctor. So, Dr. Hersh, thank you very much for your presentation. It was very, very interesting. So I'm going to read a couple of questions here from people who have been writing in the chat. So is the certification of your program given only by one entity nationwide?
Yes, in the United States, there's the Accreditation Council for Graduate Medical Education, ACGME, and they certify actually all medical residency and subspecialty fellowships. And so they certify clinical informatics and every other medical specialty and subspecialty, internal medicine, pediatrics, cardiology, etc.
Okay, thank you very much. Do you need to take all the Usmle exams in order to be eligible to take the grandfathering pathway?
Yes, because you need to have a primary specialty in the United States. So again, internal medicine, pediatrics, radiology, etc. And so you need to be board certified in a primary specialty, and then clinical informatics is a subspecialty of any medical specialty. So you would need to take the USMLE exams on your way to getting board certified.
Okay, thanks. So I forgot to translate in Spanish back to them. So, sí, en cuanto a si es necesario tomar los exámenes de USMLE para ser elegible a estos caminos que había mostrado, sí, porque en Estados Unidos se requiere una especialidad primaria para poder, digamos, aplicar luego a una subespecialidad. Y lo mismo cuando se preguntaba si la certificación del programa la da una única entidad a nivel nacional, en ese sentido sí funciona al igual que, digamos, cualquier otra especialidad médica. Y la siguiente pregunta, okay, so non-clinician informatics get some kind of certification?
Yes, that process is still in the planning process. So it hasn't been fully implemented yet, but AMIA, the American Medical Informatics Association, is developing what it calls Advanced Health Informatics Certification. And in that certification, it will be open to non-physicians, so basically to others who are wanting to become certified in informatics. The details will be released probably next year.
Okay, thank you very much. Sí, lo que comentaba es que está en proceso. Esto, AMI está desarrollando una certificación avanzada en informática en salud y va a estar abierta a profesionales no clínicos, pero probablemente recién para el año que viene va a estar listo. So I had another question. We, in certain underdeveloped countries, we have this issue that we don't balance the amount of professionals we need in a certain area. I know that in some other countries too. When do you think in the US you will get the amount of health informaticians that you really need?
Yeah, that's a good question. I don't know that I can answer that one because we actually don't in the United States balance much. I mean, people are drawn to specialties in medicine, and there are some specialties that in the United States that don't have enough people. I don't know that we really know yet in clinical informatics what is the right number of people that we need to have. So I can't really answer that. I imagine we need more than we have now, but it's hard to know the exact number that we need.
Okay, thank you very much. Un poco le preguntaba, digamos, en países del primer mundo a veces balancean un poco mejor la cantidad de profesionales que requieren en distintas áreas, y si ellos tenían una expectativa de cuándo creerían que podrían alcanzar esto en Estados Unidos, pero un poco lo que me cuenta es que no lo tienen tan balanceado en Estados Unidos, y que de hecho en muchas especialidades médicas también les pasa que no tienen la cantidad de gente que ellos esperarían. Estima y siente que más de las que tienen ahora seguro, pero no tienen un número específico. No sé si hay alguna otra pregunta del auditorio que quieran realizar o si seguimos al siguiente invitado. Maru, ¿sabes si el siguiente invitado está como para continuar? Okay, well, we have to move on with the next presentation, but I would like to thank you very much. It was a very interesting talk. And so you had all the information there. Just follow him on Twitter. It's very interesting. And so thank you very much.
Thank you. I enjoyed doing this, and hopefully next time I will be in Buenos Aires to do it with you all.
We'll hope to get you here.